Okay. When I approach a procedure in the office, I do it with the understanding that there's a protocol, there's a pattern in which I approach everything, and even though every step might not go just exactly like I would like it to go, I still have a pattern that I stick to that helps me get through and complete the procedure with as good an outcome as I can get without concerns that I'm going to have to abort or do something different. So whether it's an extraction or a crown prep or a root canal procedure or an implant procedure, I just have come to rely on my ability to think my way through in order to come out with a satisfactory outcome. If I were to say one thing, it would be that that when I sit down to do a procedure, I've already made the effort and to bridge that gap between myself and the patient to establish a level of trust that we both know that I'm going to do the very best I can for them, and that I'm going to assure them a satisfactory outcome. And so I don't have a lot of fear when I approach doing a procedure for a patient. I just have an intensity about getting it done to the best of my ability.
So when you're thinking about doing implants, what was the thing that made you motivated to do implants?
I saw right away that here was an opportunity to help people who had nowhere else to turn. And at the time when I started doing implants, it's important to remember that I think that what we're primarily dealing with was dental cripples, or people who had no teeth. The original training that I had was geared toward replacement of full arches of teeth, or sections of arches that were missing 3 or more teeth. We weren't looking at replacing individual teeth, which we are now. That being the most common use of implants now is for single tooth replacement. But at the time I started, I was looking for an opportunity to be able to help people who had nowhere else to turn.
So as you're thinking through your skill set and your skill level, how do you find doing implants versus the other dentistry you do?
To me, the most significant part of implant dentistry is being able to imagine or plan your final outcome before you start. My training taught me that implant dentistry is a prosthetics procedure, and all you're doing with implants is establishing a base or a foundation on which to restore with a prosthetic device. So what I think of when I look at a case is always, how am I going to restore this when I'm done, and then what position do I need the implants to be in so that I can achieve that outcome. So when we place implants, I'm not so concerned with having everything lined up just right and everything perfect to show in a textbook or on an x-ray. What I'm interested in is getting an implant in an area where it will support the final prosthesis that I have in mind.
So in doing implants, what things that you worry about going wrong that kind of scares you about it?
I place a lot of implants in marginal sites. Very seldom do we have an area of abundant bone, so that placement of an implant is a slam dunk or an easy procedure. So in our procedures, I do a lot of expansion of bone and enlargement of areas of bone that wouldn't ordinarily be acceptable to place implants. And I have to have a lot of faith at that time that the manner in which we're doing this procedure is going to work out, and that comes with experience. But you always have that little bit of doubt, nagging doubt, that am I really going to be able to get an implant in this space? And whether it's because of location or access or the amount of bone that you have, there are some obstacles that are going to come up, or some concerns that you have going into a surgery, but virtually 100% of the time everything works out the way you hoped it would.
So in all reality, the worst that can happen is the implant won't take, and
I'd say the worst that can happen for me is just that I will not have a satisfactory prepared site, so that I'm and which results in me not being able to place the implant, period. If I've placed an implant, I have a very high level of confidence that it's going to integrate, or take, as you might say. So once an implant is in place and in my hands, I feel very comfortable that it's going to be a successful outcome.
so do you think that any young dentist could learn to do this, or does it take a special type of person?
I think it's important that if you're going to be involved in implant dentistry, you have to have a drive or intensity about you that, number one, motivates you to be well trained before you start, because you do accept a very high level of responsibility to your patients, and you have to have the confidence that you can think your way through some of these issues as they come up. If you're timid in your approach, or if you're unsure about what you're doing, it's too easy to get in trouble when you're doing things. So I don't feel that implants are the kind of procedure that everybody should do, but I do think it's the kind of procedure that if you'll train yourself, that most dentists can do.
So if you're motivated and willing to get the proper education, a general dentist can do implants.
Yes, yes, that's exactly right. But having the motivation and the willingness to spend the time and money and effort to get that training, I think, is what separates people that do these advanced procedures and people that don't.